You're trying to do the right thing. You follow pet accounts, you read the comments, you watch the reels, and you search symptoms online. But instead of feeling confident, you often end up more confused. One person says raw is best, another says vaccines are dangerous, and someone swears that the supplements cured everything. And suddenly it feels impossible to know who to trust. The problem isn't that pet owners don't care. It's that there is more pet health information online than ever before, and not all of it is accurate, balanced, or safe. Well-meaning advice can spread just as quickly as evidence-based guidance, and the consequences can be serious. I'm Dr. Carra, and today I'm chatting with Dr. Hammond, known online as the Honest Vet. She's a practicing veterinarian who's deeply passionate about clear communication, client education, and challenging misinformation in a way that keeps pets safe without shaming the owners. Her work focuses on helping pet parents understand the why behind veterinary advice so that they can make informed decisions with confidence. If this episode resonates with you, please like, follow, and share it with other pet owners. And don't forget to subscribe to the Pause and Effect podcast. Let's get started.
So I was about, I want to say a year and a half, almost 2 years out of veterinary school. And I was really sad. One thing that I was not prepared for was the lack of trust with some of the pet parents that I would meet. Having to have that hard conversation with the owner and say, I just wanted to be like, look, you can trust me as like an honest, unbiased source of pet health information. Just wanting to kind of encourage people to trust what I'm saying by saying like, hey, I'm being honest with you.
And I mean, we're all singing the same song, perhaps in different languages, which helps because then it's applied throughout the world. But the common problems are common. And I mean, where you will see an itchy dog, where you're based, I'll see an itchy dog with the same, underlying issue. So the fact that we are all coming with the information and it's credible, but also just to be able to dispel some of the myths, because we're all learning, we all make mistakes. And one of the things I wanted to start off by asking is, where does your name, The Honest Vet, come from? Where did that originate
that's a question from? I get a lot. So I mentioned, I was about, I want to say a year and a half, almost 2 years out of veterinary school. And I was really sad. I will say sad, kind of disheartened. You think that going through veterinary school is going to be like the hardest part. And then you're going to get out and you're going to be a vet and everything's going to be, difficult. Like, that you're going to have difficult cases, difficult surgeries. But one thing that I was not prepared for was the lack of trust with some of the pet parents that I would meet and some of the things that they would tell me that they were doing. I was just dumbfounded. I was like, what do you mean? That's like, where did you hear this? Or why do you think that this is right? And people would say, oh, I saw it on a blog post, right? Because this was late 2019, early 2020 when I was first kind of thinking about all this stuff. Sorry, this glare on me from my window. Scoot over. It's right in my eyes. The sun's coming down. But anyway, I'm a year and a half out of vet school. I'm just sad at this point by seeing preventable diseases, right? And having to have that hard conversation with the owner and say like, well, if you hadn't been, maybe doing, and I don't say that, I'm like, if you hadn't been doing this, but I'm like, well, the reason this might have happened to your pet was because of this thing that was happening and we need to change it. But they know, right? They're like, well, I'm the one who was doing that, right? And I saw it and I thought I was doing the right thing. And that's just a hard conversation to have. Or, I would be in the room with a client and I'd be making a recommendation and I could just feel that they were kind of like rolling their eyes at me. Like, oh, she's just pushing these things on me. My pets don't need these things. She's in it for big pharma or whatever. And I was not prepared for any of that, right? You're not prepared for that when you go through veterinary school. And the straw that broke the camel's back for me one time was I had an owner of a new puppy come to me for like his first puppy visit. She had gotten him from the breeder like a week before. And I'm doing his physical exam and I show her his ears. He was a little doodle thing, some kind of poodle mix. And I'm like, his ears are full of debris. And it's not uncommon for puppies to get ear infections because their mother has to lick their ears to actually open them. Puppies are born with sealed ears, and then their mom has to lick them to open their ears, open their eyes, and also to stimulate them to urinate and defecate. Mom's mouth isn't perfectly clean, and it puts moisture in those ears. And so, this debris looks like an ear infection. What I'd like to do is sample it, put it under the microscope to make sure it's an ear infection and not just a bunch of junk, but we have to make sure so we're not just throwing treatments at your dog that they don't need or missing a treatment that they do need. And so she's like, well, I need to get my breeder on speakerphone first. And I was kind of like, okay, like, sure. So she gets the breeder on speakerphone. I don't think the breeder knew that I was in the room. And she was like, do not let that veterinarian touch your dog's ear. She has no idea what she's talking about. I wouldn't sell you a dog with an ear infection and all this stuff. And I'm standing like right there. And I'm kind of like, listen, you can see the debris. I can see the debris. There's debris in your dog's ears. Your breeder can't see that. I spoke up, politely. I was like, actually, hi, I'm right here. And yes, there's debris in your dog's ears and we need to clean it. And she's like, you're just trying to make me look bad because ruin my reputation with this owner. And I'm like, that's not my intention at all. Like, my intention is to make sure that this puppy is healthy. And it was so weird. And then ultimately that owner ended up declining everything. And she's like, I'm going to go take this puppy back to the breeder. And I was just like, but what about his ears though? Like, I was so sad. I was like, he's itchy, like this poor little baby. And I don't think she ended up doing his vaccines. Like, I don't think she ended up even doing anything that I recommended because this breeder was so angry that I had brought up this dog's ears. And that day I felt so defeated because all I could think about the rest of the day was that little puppy and the fact that I wasn't able to help him. And it was that obvious lack of trust. Like, this owner trusted this breeder so much more than me, which shocked me because the breeder had more of a vested interest in lying to this owner than I did, right? Like, she didn't want to have a bad reputation or have this owner write a bad review about the puppy she sold her, which is not the breeder's fault if the puppy gets an ear infection. But I didn't have any type of vested interest, right? I just wanted to make sure the puppy's ears were okay. So I was kind of just shocked by this. And that day I was like, you know what? I need to do something. I need a therapeutic outlet for this. And I'm going to start a social media, because this is kind of when that was becoming more popular. This is pre-TikTok. I think this is early 2020 when I finally decided I couldn't take these cases anymore. But then, I had to decide on a name. So sorry, roundabout story. I have to decide on a name. And I was like, well, I want people to know that this is honestly what I see and honestly what I feel and honestly what I'm thinking. And I'm not trying to sell them anything. I'm not trying to push anything on them. It's just honest information and honest veterinary insights. So I went with the Honest Vet. And part of that too is that my first name, Sylvalyn, it's just a little bit of a mouthful. And I was like, it's hard to remember. It's hard for people to find me if they can't remember what it was or spell it. My last name at the time was Simpson before I got married, but I had recently gotten engaged, and I was like, well, my last name's going to be changing, so I didn't want to go with my last name. So I went with something else. I went with the Honest Vet. And I like it, but sometimes people raise the question to me. They're like, well, by calling yourself the Honest Vet, are you calling other vets dishonest? And I never looked at it that way when I was making it. That was never the intention. I just wanted to be look, you can trust me as an honest, unbiased source of pet health information. I will never, ever recommend a product I don't believe in. I will never, ever beat around the bush in terms of, what your pet really does or does not need. And sometimes I think about now changing it. It's been 5 years. And sometimes I'm like, well, I'm not just a vet anymore. I've had 2 kids in that time. I have other hobbies and things I kind of want to share with people. But my husband, he's like, absolutely not. It's your brand. It's your name. Don't change it. Molly, Dr. Molly Brinkman, who's very popular on social media too. She's like, you can't change it. It's who you are. It's your DNA now. So I don't know. I don't think I'll be changing it anytime soon. I every once in a while I think about it, but yeah. So that's where that came from. Just wanting to kind of encourage people to trust what I'm saying by saying hey, I'm being honest with you. I'm not trying to sell you anything. There are no links to my products anywhere because I don't have them, right? There's no vested interest. I just want to help you help your pet.
I don't think you should change it, by the way. I think it's a great name.
Thank you.
I wasn't asking because I thought you should. I agree. It's your brand, so you've got to keep it.
Yeah, I said, sorry, that was all very wordy, but I just, I love it. It's hard to answer, it's hard to just be but yeah, I'll never forget, that interaction with that owner. I was just Like I was like, I can't make this up. Like no one told me this
No,
would
you
happen
can't.
to me. Like in veterinary school, this is never. No one taught me how to handle this situation. So yeah, that was the straw that broke the camel's back for me.
You look at me, I look at you, I see the love in your eyes. I'm lost in
Health you can see, love you can feel. UltraPet, the science of love.
So how often now when you're posting content, do you have to actually live by that name and say, I have to be candid, I have to be honest about this, even if the opinion or the concept I'm trying to get across isn't going to resonate?
Yeah, well, I just try to make sure that I'm being transparent in everything that I post. And, if it's a topic that's pretty nuanced, I always try to include references or sources. And I always try to tell people too, like, hey, I understand this is a common misconception, but here's why it's not necessarily true. One thing I've been, for some reason recently, seeing a lot of is like coconut oil, right? Being like coconut oil is a cheap and easy, like anti-inflammatory to give your pets, or it's going to help with their teeth, or I'm like, coconut oil is a great moisturizer. Like it's going to keep your dog's coat really shiny. Beyond that, it's not going to do really anything, right? It doesn't have enough omega-3 fatty acids. It does have omega-6 fatty acids, but like other than that. So like, that's one thing where I'm like, listen, honestly, you can give your dog coconut oil, but please do not mistake it for some miracle thing. I saw another post the other day saying it's good for seizures because it has MCT oil in it. And I'm like, the amount of MCT oil in coconut oil is so minimal that you'd have to give your dog like a jar of coconut oil every day. And then they'd probably die of pancreatitis. So like, honestly, that is not a good idea, right? But like, yeah, the stuff that we see these things, like what the reason it gets to me is I'm like, there's probably some wonderful, well-meaning pet owner out there whose dog has seizures, and maybe they're, trying to find a cheaper way to manage them, right? Because these things can be expensive. And I totally understand that. I will always sympathize with that. It is tough. Or maybe maybe their pet is not doing as well on the seizure medication as they would like or whatever. And they're like, they come across this post saying, oh, coconut oil can help with my dog's seizures. I'm going to start giving my dog a bunch of coconut oil. And then they can give their dog pancreatitis, right? So like now they've got seizures and pancreatitis, but they're still having seizures, or they've just like wasted a bunch of money on expensive, like extra, virgin coconut oil or whatever. And it didn't help. So like, that's where these things get to me. Like, I don't want people to waste their time and money and energy and efforts on futile treatments just because somebody didn't understand the science behind their recommendations,
Totally agree. I mean, we see it all the time. But I mean, before we tackle some of the top questions, why the lack of trust? Why? No, this is exactly what this is for. But why the lack of trust in us as professionals? Where do you feel that that's come from? I don't necessarily believe that is, doctors were always respected and vets were relied upon. And where did the lack of trust come from? Or the questioning?
I do think the internet coming around played a big role in it, in some of these blogs, right? So my mom was actually a veterinarian. She was a rural veterinarian. She did like large animal mostly, but so she was actually, my mom was an equine reproductive specialist. So she would literally like go around and do like artificial insemination, embryo transfers, breeding horses, semen shipping, all those things. I mean, that was her bread and butter. I grew up in southern Arizona. We have a huge horse population in Arizona because in Arizona it's kind of sunny all year round. So great weather for riding all year round. We don't get, snow. It gets hot, obviously, but in the desert, there's no moisture in the air to retain that heat. So like early morning and late night, I mean, Africa is very similar, that same climate where it's pretty dry. So, it might be 110 degrees in the hottest part of the day, but at night it'll still be like 60 or 70. So if you get up and ride your horse early in the morning, it's very safe. So anyway, tons of horses. But when you're doing farm calls or driving around to people's horsey businesses, they often also have like a cat or a dog, right? And so they'd be like, hey, doc, while you're here, can you look at my dog, or can you help me spay these? I've got this cat that keeps having litters. Can you spay this cat for me? And my mom would be like, sure. And so she would see everything. She also did, she would do farm calls for like some of like the local 4-H kids. So like, you know, we had cows on our property too. So she did cows, pigs, goats, all these things. But her main bread and butter was the horses. But I remember, so my brothers and I were essentially like slaves. This is a good era of child labor, right? So Saturday morning, she'd load us all up in the truck or whatever, and we'd go off and we'd help her because, you know, she'd need help holding these animals or restraining these animals or just going around catching things, moving things through chutes, drawing up medications and stuff for her. We were doing all of those things from a pretty young age. And I always saw my mom interact with her clients, right? And so I think this is another reason I was so dumbfounded post-graduation is I don't remember any of my mom's clients ever questioning her advice. I really don't. Like, I do not remember it happening. They would listen to my mom, you know, and this is the, you know, late 90s, early 2000s. And they would listen to her, you know, they'd say, hey, my dog's doing this. What do you think? And my mom would say, oh, you know, blah, 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 blah. You should try this supplement, or you should do this, or maybe you should cut that out. And people would say, great. They'd write it down and they'd go do it. And then my mom would come back in 3 months. She'd say, how's this dog doing? They say, oh my gosh, so much better. I'm so glad you told me about blah, 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 blah. And so when I graduated now, you know, now we're in the late 2010s, right? So I graduated in 2018. So now we've had the internet pretty widely available. Like when I graduated high school, I remember my parents didn't have the internet at home. Like I had to go to the library and we had to do like the dial-up thing if I needed to use the internet for a school project. And when I'd come home from college for the first couple of years, I had to go into town and go to the public library to do any schoolwork. But now that's unheard of, right? Everybody has the internet and everyone's got a phone that has access to the internet all the time now. You don't even need a computer to get on the internet. So people can, you know, they used to, you know, they were at home, they were on their computer, they started to see these blog posts or these email threads that were shared. And I think that's where some of it started. And then, of course, now it's just all over the place, right? There's so much noise. And I think that creates a bit of distrust. I'm sure there was some distrust before that too. I think my mom just probably had great clients and had great relationships with them, and they'd been relying on her for a long time. But I do think now people are experts because they've read a few blog posts, but they're not trained in identifying credible information like we as veterinarians are. Like in school, we are taught how to read and, you know, identify bias or confounding variables and all of those things in research papers, right? We are trained on how to spot credible misinformation or how to spot holes in not credible information, but the general public isn't, you know? So I don't know, I sound like an old lady, but I'm like, it's the internet. I think the internet really has played a huge role in this distrust because people just don't necessarily know who to trust. And you hear these horrible stories about like, oh, I took my dog to the vet and the vet like gave my dog this vaccine and then a week later he died and it was obviously the vaccine's fault. But then again, we as scientists know like, okay, well, how do you know it was the vaccine? There are so many different things that could have gone wrong here. But just somebody who doesn't know would come across that and they'd be like, oh my God, I don't want my dog to die. Right? Like, I don't want to give my dog this vaccine if it killed their dog, even though there's no evidence that it actually killed the dog, you know? So it's just, yeah, I think the internet, a big player in it.
And pet owners often say everyone online has a different opinion.
Yeah.
So why is it that evidence-based information matters so much when it comes to animal health?
Well, kind of like what we said, if you're giving, you know, if you're just taking advice from a post online without checking it first, you could be wasting your time, your money, your resources, and also jeopardizing your pet's health to try to do something good, right? If you haven't checked it. So that comes back to that coconut oil example I pulled up earlier with the MCTs, right? Like, probably not going to help your pet with seizures. There are other cheaper supplements that you can try that actually might help, right? So like, don't waste your money on something because it's not just that the information might not help your pet, but a lot of it's potentially harmful. So that's why evidence-based information matters so much. And it doesn't just matter for pet parents, it matters for veterinarians too. We know that the caregiver placebo effect is very real and that the caregiver is the veterinarian and the pet parent, right? So me as a veterinarian, let's say I believe in, I'm going to just use it. I'm going to keep using it as my example, like coconut oil, right? And I'm like, I read a paper that said coconut oil is great for seizures, but I didn't actually bother to look at the nuances of it. And then I could put my own, I give the owner the coconut oil, and then the owner gives the dog the coconut oil. And we, as the caregivers, we have that caregiver placebo effect where we see the dog and we're like, it definitely is helping. It's gotten so much better. But if you look at the data is like, there's no way that that's possible, right? It's not possible. There's no way. So then we have to think, could this be the caregiver placebo effect? And then we have to rely on objective data, like hard data. So in a case of seizures, that would be, have the seizures gotten less frequent? Have they gotten less severe? That's how you measure objective data. And so that's why it's so important to rely on objective data. We cannot, rely on subjective data, which is what parents, that's the anecdotes, right? People are like, I put my dog on raw food and now they're all better. They're thriving. And I'm like, okay, well, that is nothing but an anecdote because you don't have the objective data to show that there was any true changes before and after. You also can't tell me that it was just the food itself being raw that provided that change, right? Maybe it was because you switched from kibble to fresh food. So what if we just cook the meat, right? And now you have food safety and better food, and you're seeing all the improvements. So that's why we have to rely on that evidence-based data. If you just rely on anecdotes or subjective data where people are just reporting things that they see, you can cause harm to your pets, which is the last thing anyone wants. The reason people are consuming this information is because they love their pets and they care. So the last thing they want is to accidentally harm their pets. And if you're not relying on objective data, you can do that. And it can be severe. It can be life-threatening. And that's why this misinformation is a real problem.
So how do you advise pet owners tell the difference between reliable advice and content that sounds convincing but isn't actually safe?
Yeah, that's great. That's such a good question. So one is to consider the source. So is the source, do they have any credentials, right? Are they a veterinarian if you're looking at pet information? Or, what are they an animal scientist? Do they have any advanced education specifically in animal health? Then you also have to look at, are they able to provide any credible resources? So it's one thing to just be a doctor and to say something, but like you mentioned, there are bad apples in every orchard, okay? And there are some people who have financial incentives to get you to feel and believe a certain thing. So that's the last thing I'll say. So one is, check your source. Do they have credentials? Do they have evidence to back up their claims? And lastly, are they trying to sell you something? Because if they're trying to sell you something, you immediately need to stop and consider their motive, right? So is this person trying to get you to distrust veterinary medicine so that you'll sign up for their ebook, right? Or are they trying to get you to, distrust conventional pet food so that you'll buy their brand of pet food or a brand of pet food that they have equity in? You have, it's kind of sad, but you really have to be so skeptical of everything that you see online. And I always tell my clients, because I have this conversation with clients all the time, you have to be careful. And if you ever see anything on social media that you're curious about or sounds good or worries you, please send it to me. Just send it to me. I am more than happy to review anything and then tell you my honest opinion on it or whether or not it's credible. Then you can implement it for your pet or choose not to. But please, please, please don't just see something on social media. Be like, a doctor said it, and then implement it for your pet. Because one thing that we're seeing right now very prominently on social media are AI-generated veterinarians. I'm sure you've come across these. Oh, scary. My gosh, I cannot keep up with them. There are hundreds, probably thousands of accounts where it says, I've been the top veterinarian out of practice for 32 years, and these are the things I would never do for my dog. And then they usually give 5 or 6 things. And then always at the end, it's and then this is why I started this collagen supplement or this green powder. So it's these accounts that are being completely generated and all these fake veterinarians completely generated to push these supplements. But the supplements are usually very crappy, right? They're not third-party tested. There's no quality approval seal. but that's the reason they have to rely on these fake veterinarians in order to sell their product, right? Because it's a crappy product and no real veterinarian is going to look at that and put their name behind it. So now I'm telling people like, hey, even if you see doctor or somebody says I'm a vet, double check, first to make sure that they're actually a vet. And then, like I said, look for the evidence and then see if they're trying to sell you something. If their, advice always ends with a plug to buy something, I wouldn't trust it. And that sounds sad. And I'm sure that there are some really great veterinarians who are selling some really great products, but just don't take their name for it. Double check it with a veterinarian that you know and you trust.
And what would you say are the top pet health myths or trends that you see repeatedly that you find particularly frightening?
Yeah. So, one that we see very, very commonly is feeding raw food or not raw food, but raw meat-based diets. So just we know that raw meat can carry E. coli, salmonella, listeria, parasites, neospora. There's so many different organisms in raw meat that simply cooking it will get rid of, completely eliminate that risk. And if you're gently cooking the food at home, you don't have to worry about like charring the nutrients out of it, right? Because that's one thing we see. They're like, oh, if you cook the meat, there's no protein. And I'm like, okay, well, I eat cooked meat and I'm not protein deficient, right? I'm not a dog. So of course, you have to have that nuanced conversation. But if you're like boiling it or slow roasting it or whatever, it's going to be fine. Like it's not going to lose all its nutritional value. So you can completely eliminate all the risks of foodborne illness by simply cooking that meat. And then you can still feed your dog that nice home prepared food that you were going to feed them in the raw version. But now you can feed them all of that without the risks of foodborne illness. So raw meat-based diets are one that we just cannot seem to put to rest. That's a myth. That myth it's very hardy. That is a hardy myth. It's difficult to eliminate. And then, unfortunately, we are seeing a big rise in the vaccine hesitancy in pet parents. And I'm not sure if that's as prominent for you in South Africa, but it's been pretty bad here in the United States and becoming more and more common. And thankfully, most of the time, when I get a client in the room and they express to me like, hey, doctor, I am a little bit worried about doing these vaccines, then I'm able to say, here are all the numbers. Here is all the data. I'm printing this for you. I'm showing, I'm giving you resources and stuff, and people, and I can explain to them, how often this disease happens and these things versus how often we actually see any side effects to vaccines. And that often, people will usually say, okay, yeah, I see your point. I completely agree with you. Thank you for putting my mind at ease. And I do want to go forward with the vaccines. But I always worry like, okay, well, some pet parents, they might only come to the vet once a year for vaccines, right? So now if they're like, well, I saw online that vaccines are bad for my dog or my cat, so I'm not going to do vaccines anymore. So then they stop coming to their annual veterinary appointments. And that is really sad, right? Because so many times, like we have trained eyes and hands. And I can sometimes just like, I'll be talking and I'll be feeling, and I can just feel when something's not right because my hands have that muscle memory, right? I can suddenly feel like an enlarged lymph node that the owners might not have noticed as soon as I did. Or, I can get a good look in the back of the pet's mouth because I'm scary and they're like weary of me and they're being a little bit more cooperative, or I just know how to maneuver my hands so I can see like, oh, wow, your dog has like a really bad broken tooth back here or a really infected tooth and we need to get that out before it abscesses. Or I can feel things in the abdomen that don't feel quite right, be like, hey, these kidneys feel a little asymmetric, or I can feel something here that could be, signs of an early tumor or something. Even joint changes, right? Like how often are pet parents evaluating their pet's joints? They might not really notice arthritis until they're seeing lameness, but you and I might feel some clicking or crunching as we put those joints through a range of motion test. And so I worry that not only will the vaccine hesitancy result in more preventable illnesses in pets because people will stop doing the vaccines, but it might also result in just less care for pets in general and more things missed until they're serious. Because you and I both know that the sooner a disease is identified, not only is it easier to treat, but it's usually much more affordable to treat, right? And our treatments are more effective. But pet parents might not understand that. They skip their wellness visit. They skip the wellness blood work because they didn't come into the wellness visit for me to explain how important it is. And then they bring their dog in when they're severely ill. And at that point, it's like, okay, well, your dog has to be hospitalized and they're going to need all these medications and all this workup. And then they're looking at like maybe like a $3,000 bill as opposed to that $300 annual appointment where we could have caught all this and maybe made adjustments earlier. So those are probably the two biggest things that I'm concerned about right now. Obviously, there are lots of other little small myths and nuances, but yeah, these are two things that I think can cause a lot of preventable illness that could be avoided. And again, it comes down to pet parents who truly think they're doing the best thing for their pet and they just want to protect them, but they're getting caught in traps of misinformation.
Why do some of these myths persist for so long, even when there are people out there like you trying to give evidence against them?
I wish I could answer that. I wish I knew, because I feel like if I knew and I understood that, I might be doing a better job at stopping them. But I think the problem is that the misinformation is often fear-based, right? So fear will always spread faster than fact, right? It's going to incite that emotional response in you, whereas a fact, you're just like, okay, processed, understood, check, move on. But you don't have the urge to react to it the way you do to fear-based information. You don't have that sudden panic of like, oh my God, if I don't do this now, something bad will happen to my pet, right? Or I need everyone to know about this so that nothing bad happens to their pet. So misinformation can spread so much faster. It's like a wildfire, right? It just, everything ignites around it. Whereas facts, again, it's rational. There's not that knee-jerk response to it. There's not that fight or flight response to it. And so it spreads slowly. And unfortunately, sometimes the information that reaches somebody first is going to be what they subscribe to. And that comes back to our conversation about like, that's why I'm like, okay, every vet that can get their voice out there or wants to get their voice out there, because it's not easy, right? Putting your face out there, putting your name out there. People are mean online. People have said things that have really hurt my feelings. And, most of the time I'm pretty good at just being like, okay, whatever. I don't know you. You don't know me. It's fine. But it does get to you sometimes. So I totally understand it's not for everybody. And a lot of veterinarians don't want to do it for that reason. But if you're a vet who has any desire to do it, or if you feel frustrated and you need an outlet for that frustration because you're tired of seeing preventable diseases and sad situations, then I say do it, because hopefully your voice can reach people sooner and your facts can reach people sooner. But it is difficult competing with that fear-based information spreading technique, because it works, right? Fear is a fantastic marketing tool. It really is. And it instills in you that need to act. And that's the last thing that I want anybody to do, right? Like, people always say that, like, oh, you're using fear mongering when you talk about the fact that pets will die without vaccines. And I'm like, well, no, like, because I have the data, right? Like, I have the data to show you like what can happen if you don't vaccinate. Whereas like these other people don't have that. They're just throwing it out there. So yeah. But in terms of why they persist, I
don't know.
Yeah. I don't know. What do you think?
It's a shame.
You have to tell me, because I don't know.
I don't know. I often reflect on this, and I wonder, like, who's shouting the loudest, who's got the biggest platform.
Yeah.
I think, I think it also probably stems in very strong beliefs about particular things, and when it's backed up by something that people can maybe associate with, rather than it's quite technical. So, the whole raw meat, because they originate from wolves, that's a lovely storytelling way. And people think, I want to, we're evolving is not the right word to use now in this discussion, but we are trying to get better at meeting the needs of our pets. And, maybe we've been doing it wrong all this time, and pet food companies are just trying to profit from us. And I'm doing the right thing. So great intentions, as you mentioned, just not necessarily the other scientific understanding of the risk associated with that, even down to bones.
Yeah, that is a great point. Like, their simplified versions are easier to sell because they're easier to understand, even if they're not right. That is such a good point. Yeah. Whereas us, we're like, no. And we come in with the words that, like foodborne pathogens, listeria, salmonella, it's like, it's harder to digest if you don't have that scientific or medical background. That's a great point. Yeah. I forget that. You forget what you didn't know, right?
Yeah. And even down to, so I have a particular interest in nutrition, which is why the raw food comment from you, I'm just like, oh, yay, someone else, talking my language is wonderful. But I also, when it comes to, I totally agree, rather cook it. That's that I can get to. If it's really important for you, then let's talk about how balanced that meal is, because we know in our diets that we vary what we eat. And when something goes wrong, either your skin goes dry, that's generally when people are like, oh, I need to increase, maybe I need to eat some more avos, or I need to increase the amount that I'm, so you can see nutritional deficiencies. But the problem with our pets is their lives are kind of compacted into this what is way too short as far as I'm concerned. And then it's not necessarily the next day that you're seeing a problem, unless it's a pathogen. There's no doubt about it. But even with subclinical disease, even shedding those pathogens all over the house, they may be fine, but it doesn't mean that the risk is not there. And because you can't visualize it, you can't visualize deficiencies necessarily until, there is a disease process long after that doesn't necessarily even connect with nutrition. And I think those are the frightening and difficult conversations to have with owners, because they're nuances and it's a complex subject. So I feel a lot of frustration, but even when it comes to owners who are really adamant, and I respect the fact that owners want to cook for their pets, I actually say, I think cooked food smells a lot better than raw food, in my opinion. When
agree.
You come home and something's baking or something's cooking, I'm like, I actually think they're going to enjoy the cooked food more, and you're going to reduce the risk of those pathogens. And if you get, a veterinary nutritionist or even an animal nutritionist to formulate a diet for you, you will ensure that it's balanced, and you can ensure that they are, long term, that you're meeting their needs. So there are so many things to the raw food discussion that just actually breaks my heart, because, we're talking to veterinary dentists about bones, and people go, but it's a natural behavior. Dogs like to chew bones. I'm like, dogs like to eat other dogs' feces. Dogs like to. Lots of things dogs like. They like to jump on my lap, even though.
Yeah, that's such a good point. I want to actually just take a second. You mentioned too, like how how you feel and you can react to it, right? And that's one thing I tell people, like, about the annual wellness blood work or the nutrition balances, right? Like, pets can't tell you that they're feeling a little funny, right? They can't be like, my energy hasn't been great, or I've just been feeling a little like sluggish lately, or my stomach's been a little off. You as a pet parent have no idea what they're feeling really until they actually start to show outward clinical signs. And then it's like I said it before, it's harder to fix or feel. So, and these things take a long time, especially if it's nutritional, right? It takes a long time. So whereas we can be like, oh my gosh, like I think I'm pretty dehydrated, or I think my skin's been a little gross lately. I've probably been having too much sugar, or, oh my God, I need to maybe eat some more protein because my energy's been down, whatever. We can respond because we can feel those shifts in our own body on the day to day. But our pets usually don't show that, right? We don't show that. Like, if you looking at me right now, you'd have no idea like how I'm really feeling inside, right? We can put on a smile, we can put in a face, we can go to work, we can get through it, we can drink an extra cup of coffee, whatever we need to do. But we're the only ones who really know how we're feeling compared to our normal baseline. And it's the same for our pets, right? So until they're really starting to feel pretty yucky, you might not notice anything. And that's why it's so important to make sure that you're following proper guidelines, because you don't want that to slowly be happening until you get to the point where you actually have developed clinical signs of illness.
I totally agree. And I mean, we discuss it when we discuss pain. You may have a really stoic dog that another dog would be non-weight bearing, and then this dog is walking around. So, it's the same thing. There are subtle things, breed preferences, in terms of the way in which they're going to display. I may be feeling really flat today, and another dog may be running around. They both equally have the same problem. So you can't necessarily even say, a cat's going to display the same behavior when they're in pain, or that they're not well. Or so that's why we have to do our best as pet owners, and we are pet owners as vets as well, to try and ensure that we can mitigate that risk.
Yeah. I've always found it very interesting whenever I have ailments or diseases as a person, right? To be like, oh, that's what my patients are experiencing. And it can kind of shift your brain. So I used to be a pretty avid long distance runner. I mean, I was like the little engine that could. It was almost therapeutic for me, just like kind of helping to deal with that anxiety. And I started to have some knee pain when I was about late 20s, so like 27. And I went to my primary care doctor and I said, my right knee is like really hurting me. Like when I go up the stairs, I get kind of like a sharp pain. And she was like, well, are you still able to do the things that you want to do? And I was like, well, kind of like for the most part, I just like take an ibuprofen. And she's like, okay, well, you don't need to do anything. There's not going to be like, they're not going to do surgery. They're not going to help you or anything until you're like starting to experiencing like limping and things like that. But no one would know that I was having limp pain, or knee pain, right? I wasn't limping. But every time I would take a squat or like bend down, my right knee would really hurt me. And this is, I was only a few years into being a veterinarian. And then it was like a few years after that, I was like, wait a second, like my knee really hurts. And like, I have stopped doing some of the things that I really like to do just because I don't look like I'm painful. Like, I think I should get another opinion. So I went back, I went to a different doctor. She put her hand on my knee and I flexed and extended my knee. And she's like, oh God, that feels horrible. And I was like, it really hurts. Like my knee hurts. So I went to an orthopedic specialist. They did an MRI and I had lost all of the cartilage on the inside of my kneecap. And when he showed me my MRI, he said, you told me that your pain score was like a 2 out of 10. And I said, well, yeah, because it like kind of hurts. But he's like, you have you have bone on bone from your femoral head and your patella. He's like, this is like 8 out of 10 stuff. And I was like, well, see, like an 8 out of 10 to me is like a lion is eating my intestines. like to me, like that is what and he's like, you probably should have had this surgery like 3 years ago. They had to go inside. They had to remove all those little cartilage flaps. It was like having a rock in my shoe, right? I had a piece of cartilage that was just rubbing and rubbing. And because of that, I lost all the cartilage on the inside of my kneecap. And you and I both know that once cartilage is gone, it doesn't like regenerate, right? So it still hurts. I got the surgery. It's much, much better. I still get knee pain. I don't run like I used to. But now when I have owners who come in, and I went to physical therapy. My physical therapist was like, the size of your right leg is like 60% smaller than the size of your left leg. And I didn't even notice. I had been compensating my weight to my left side for so long. So now when I have this conversation with pet parents about early like arthritic changes, I'm like, no, we're going to act now. We're going to do things now. Here are all the things I want you to change, because I know that even though your dog's not limping, even though your dog is still doing all the things your dog wants to do, that probably hurts. Trust me. I know. So I don't want pet parents to wait until they're seeing that limp before they make changes, right? Because at that point, like, who knows how bad it is and how much it affects them. So that's, again, back to that annual wellness. Like I can feel for that crepitus that I have in my knees, and I can feel it in the dog's knees or elbows or whatever, and be like, hey, we're going to start an omega-3 supplement. We are going to work on maybe some weight loss if they're a little hefty. I measure the muscle size if I can. You can measure the glutes with a little like a fat, like those little like fabric-y measuring. I don't know what it's called. But you can take measurements of the muscles to make sure there's not some muscle loss on one side or the other, because I experienced all of this, and it's so interesting to have lived it, and then you treat it and diagnose it, even in an animal, because if you had looked at me, I was still out there running 5 miles with my ouchie knee. Apparently I was putting more weight on my left leg than my right. Didn't know, but I must have been. And so no one would have known that I had lost all the cartilage on my patella. I didn't even know, right? I was like, and again, it comes back to how stoic are you? Like genetically, what is your threshold and tolerance for pain before it starts to show outwardly? But yeah, having experienced that it kind of, I think it makes me better at explaining it to pet parents. And I'll be like, oh, your dog's got crepitus in their knee. And they'll be like, what's that? And I'll be like, put your hand on my knee and I'll show you. I'll show you. Right? I'm like, this is what crepitus feels like. So I'm like, you don't want your dog to live like this. I'm only 33. I'm probably going to need a total knee replacement in another 20 years. But, I'm hopeful like by then it'll be really good. They'll have really good knees.
Very advanced medicine and treatment options for you.
Yeah.
But
We're going to hold out as long as we can.
It's do. It really is a lesson in early intervention as well. So to say, there is progression of disease, and if you are able to act early on, then you may be avoiding pain and arthritic changes that will ultimately result. And like you say, muscle mass loss and gait changes and so many things. So I totally agree. But let's go to, what is the one question you wish pet owners would ask their vet because it could genuinely change the outcome for their pet, particularly in the consult?
Yeah, I think the vet maybe should bring this up, but I think if pet parents aren't sure, they should always ask, is my pet's weight okay? Because, and this is where, part of why my honest vet came around is that I'm always honest. There's a lot of emotion that comes into talking about weight, right? We never want anyone to feel like we are picking on them or picking on their pet. We never, ever want them to feel targeted. I'm always careful with the words that I choose, but I explain why it's important, right? Like, I'm not saying this to make you feel like a bad pet parent. I'm not saying this because I'm fat shaming your animal, but we have data and literature and lifelong studies to show that pets who are kept lean live longer. And it goes back to what we were just talking about with arthritis. Like, we can take some of that extra stress off of those joints. Or, we know that fat cells are not benign. We know that they're inflammatory, right? So they are upregulating inflammation in the body, and that can cause, worse allergies for those itchy pets. That can cause worse arthritis for those knees, even organ dysfunction. So because we have more data on that than anything else, and that's one of the easiest things that we as pet parents can do to keep our pets healthy, is just try to maintain, that lean body condition and keep them active as long as possible. Because, if you don't move it or use it, you lose it, right? So you've got to move it. And then your muscles, they don't just, move your joints, they protect your joints, right? They're a cushion. And it's so important, to maintain that mobility and maintain that lean body condition score. So I always tell pet parents, if you're going to have any question when you go into the vet, it's like, how's my pet's weight today? Do I need to lose any weight? Are they ideal? Or even asking about how to assess it yourself at home. One thing I see a lot with pet parents, right, is they only weigh their pet that once a year when they come to the vet, right? And your weight can change so much in a year, right? Like, women can have a baby in a year, right? You can get 80 pounds in a year. Like, your weight can change so much. And we'll see this sometimes where pets will come in. I had a patient this week. She was always like 70 pounds. And she came in this year and she was like 78. And she looked it, right? And so I looked at, I said, well, okay, well, we also need to discuss that your sweet girl has gained 8 pounds this year. And that's, actually a significant amount for her. That's like 10% of her body weight. And usually it makes sense, right? They're like, oh my gosh, I have a 1-year-old baby in the house and they're sharing food. And I'm like, okay, I understand that. Now we know it's a problem and we can take steps to intervene and at least stop it from getting worse, right? So we can maybe, unfortunately, put her in another room during baby's mealtime, or try to make sure that baby's not sharing too many snacks with the pet, or maybe cutting back on her main meals during those times where she does, because I have 2 little kids. They love to feed the dog. They will throw their plates sometimes. And then like, I don't want to clean up the floor. So I'm like, all right, buddy, have at it. Like, you clean up for me. But then I'm like, okay, my dog ate like a whole toddler-sized meal, so maybe I'll only give him 1 scoop of food tonight instead of 2. And obviously that's not great if you're doing that like every night, because then you have to worry about like dietary imbalances and stuff. But if it's happening like a couple of times a week, in the long run, you're probably going to be okay. But yes, I would always ask pet parents to ask, what is the body condition score of my pet, and tell me honestly, because I need to know. Because, our pets don't have opposable thumbs.
No, and I totally agree, because the other applies too, is that if they're losing weight and this has been sort of over a long period of time, and it's slow, owners don't always notice, especially if there has been intentional weight loss. So, your previous consult, you said, hey, listen, can we just try and just reduce body weight, however you fresh your conversation, and it's been intentional. But on top of it, there's now a problem, and they have underlying kidney issues, for example, and they're losing weight due to some, and that's frightening, because owners are like, look how great they look, and you go, no, this is now not normal.
Yeah, or especially with cats, because sometimes with cats, weight loss is the only sign that we have that anything has changed. Especially in multi-cat households, right? Because you don't know how much that cat is, like, you might not notice that cat hasn't been eating because their siblings have still been eating all the food in the bowl, right? So you're filling up the bowl is empty. You're like, okay, everyone's eating. And then you come to the vet and the cat has lost like 5 pounds, right? And you're like, oh my God, I did think they looked a little slimmer. I didn't realize it was so drastic because, like you said, you're seeing them every day. And so I do tell my pet parents too. I said, you can always pop in the clinic. Like if you're passing by on a walk, weigh your dog, or just think about coming in maybe every few months if you haven't and weigh them. Or with your cat, cats are easy because you can pick them up. So it's not as accurate as like a baby scale, but you can step on the scale, you can weigh yourself, you can step off the scale, pick up your cat, step on the scale again, and then do the math. And you're going to get at least a rough, like if they've lost a substantial amount, you'll see the difference. So that's just an easy thing pet parents can do to kind of keep an eye on their general health.
Totally agree. So, and other than weight, are there warning signs or symptoms that owners often dismiss or they normalize that they should really have checked sooner?
Yeah, so just like subtle behavioral changes, particularly around like eating and drinking. Sometimes people are like, they've noticed they've been drinking a lot of water lately, but I just thought maybe that they were like hot or something. And of course, if it's a few days that they've been drinking a lot of water and maybe it has been really hot outside, then I wouldn't stress. But if it's like an ongoing thing, you're like, the whole last week they've just been drinking tons of water, or maybe they've been acting way hungrier than normal, even though I haven't changed what they're eating or their exercise habits haven't changed. Kind of subtle behavioral changes. I always tell people, like, your pet best. So if something like suddenly changes or seems peculiar to you, don't dismiss it. Write it down, note it, monitor it. And if it doesn't go back to normal or if it continues to progress, then that's a sign to come see us. Because even if you think you might just be being paranoid, you might truly be catching something very early. I've had times where pet parents have brought me their pet and they're like, I don't know what it is, but something just seems off to me. I can't explain it. Maybe they're being a little clingy or something, right? Like they won't leave my side. They're kind of whining. And I'm like, okay, I believe you. I did a physical exam. Your physical exam is boring. The TPR is unremarkable, but you know them best. So like if it's a senior pet, I'd probably like, even younger, I'd be like, let's just do some blood work. It's easy to just screen what's going on the inside. Let's just start there. And the amount of times where I have seen something come up, it's, maybe it's a little UTI or maybe it's like early kidney stuff. They're just not feeling good. And that's the only way they know how to tell you is to follow you around, right? Be like, I don't feel very good. I'm going to go to their comfort person. So I always tell pet parents that your pet best and never to feel silly. Sometimes people are like, I'm just being paranoid or I'm just being, over the top or a helicopter mom. And I'm like, no, please don't apologize. Like I'm the same way with my pet and you probably too, right? Because we've seen all the worst case scenarios. So I feel like I'm always like, oh my God, my dog has cancer. he threw up this morning one time if somebody had called me and they were like, doctor, they threw up this morning. I'd be like, let's keep an eye on them. Don't panic. We all get upset stomachs. But when it's your own pet, you're like immediately like panicking because we see all the horrible stuff. So I always tell people like never, ever apologize for being safe and double checking.
I'm the same. I'm like one vomiter. I'm like, please don't let this be an obstruction. It's going to be so embarrassing at the practice. They're removing a sock or underwear or something or a bone, and I don't feed the bones.
Yeah.
Or corn cob, and we, no.
It's going to happen one of these days. It's going to happen. I have insurance for my dog because, again, I have 2 little kids, and my house is basically like a foreign body party, just waiting to happen. Luckily, Frank is very good about not chewing the kids' toys and stuff, but you never know. So, yeah, I'm so paranoid.
So talking about us, obviously, as pet parents who worry, tell my listeners about how early intervention can really change outcomes for pets compared to waiting things out or trying online advice first.
Yeah, no, it's such a great point. And it's what we talked about earlier. Like the earlier we catch things, the easier they are to fix. And often, like I said, the less expensive, right? Like if we catch things before your pet is like super clinically dehydrated and very, very sick, then they might not need to be hospitalized. So you've already saved yourself quite a bit of money. Hospitalization is unfortunately expensive, right? So like, let's talk about, diabetes. So early things you might notice, like increased thirst and urination, increased hunger. And if you're like, this just seems odd, I'm going to go check it out. You can come in, we can do a quick quick blood test. You can be like, oh my gosh, your pet unfortunately has developed diabetes, right? And we can start insulin and you can go home with your pet today. And it's going to cost this much money. It's going to be all outpatient therapy. We're going to talk about glucose monitoring, all these things. Whereas if you're like, increased thirst, oh my gosh, you go online, you Google it, increased thirst. There are so many causes of increased thirst in your pet, right? You might be like, maybe there's too much salt in their kibble. So you try switching their kibble first, or, something like this. You try all these other things. And unfortunately, the problem is just continuing to get worse. And then your pet might go into diabetic ketoacidosis, which is life-threatening, right? So now your pet has collapsed. So you have to rush them to the emergency hospital, already going to be more expensive than just walking into your general practitioner. They're going to have to do all those blood tests that we would have done, but it's going to be on an urgent basis. And so again, it's going to be more expensive just because it's a supply and demand thing. And then your pet's going to have to be hospitalized for days. And that's going to be expensive. And then after that, they're still going to have to come to see us to have that exam, to check on their progress, do some more blood work to make sure all those values have gone to normal, and then do all the stuff to start management of diabetes. So if you had just kind of come to us first, you could have skipped that whole emergency room experience and that $3,000 to $5,000. I'm not sure how much it costs in South Africa, but roughly here, depending on the size of the dog, that's maybe even more now with the economy being the way it is. And so for some people, they might not be able to do that, right? I can definitely think of a lot of families that I know that would very much struggle to spend $5,000 on their pet short notice, right? That's a lot of money. And, then you might even be talking about having to put your pet down. And that's not horrible. I never, ever, if they're like, I do not have the funds to do this, I will never be like, you're a terrible person. I would, as long as you don't let them suffer, that's what matters. So if humane euthanasia is the route that you need to take to make sure that your pet doesn't suffer, I will never, ever judge you for that. That is a wonderful option that we have, as sad as it sounds, but it's very realistic and reasonable. And even for some people, there are some pets who are just not going to tolerate twice-a-day insulin injections. Some just are not. So sometimes even with patients that could be treated, you can't treat them. So that's neither here nor there. But that, I'm just saying, if you didn't have to go through that scary experience of the emergency clinic, if you had just brought your pet in to see a vet earlier and get a veterinarian's opinion on what's going on, as opposed to trying some DIY stuff at home, you wouldn't be in that horrible situation of having to decide between, taking on debt or your pet's life. That's never a situation anybody wants to be in. And we could think of that for many other things, like kidney disease could be the same, right? Those toxic metabolites build up in the body. You might be noticing your pet's losing weight, but you're not sure why. So you try some DIY stuff because you want to save some money. And then those things are just still building up in the body. And then it gets to the point where your pet is so sick that we might not even be able to do anything because their phosphorus is so elevated and their prognosis is so poor. So always, seeking advice from a veterinarian earlier rather than later is crucial.
And from your perspective, what preventative care steps make the biggest difference to long-term pet health?
Right, that's hard. Well, honestly,
I'm throwing you in on the vaccine thing again. Sorry, but and I don't know. And again, I don't want to assume in South Carolina whether you've got a problem with fleas and ticks, but obviously that's a big thing for us here: worms, fleas, ticks. So I'm slightly
I always tell
setting
people,
you up.
You're not a bad pet parent if you're not doing the whole 9 yards every time, right? So when your dog is younger and it's unlikely they're going to have any organ dysfunction or anything. If you skip that annual blood work because you need to save a couple $100s, that's okay, right? Maybe when your pet is 8, 9, 10, we really need to start thinking about doing it if we can. But as long as your pet's basic needs for health and wellness are met, then you're doing a great job. So that includes, obviously at home, having a safe, warm and dry place to sleep every night, a complete and balanced pet food, whether you're making it at home, which is obviously amazing. If you're making it at home and you've worked with a nutritionist and that food is complete and balanced, of course, that's fantastic. That is great. Obviously, we would all do that if we could. But even if you're feeding a very affordable pet food, as long as it's complete and balanced, that's what matters. And you should not feel shamed for doing that. And then as long as your pet has access to clean, fresh drinking water all day at home, and exercise, right? Those are just, at least 30 minutes of exercise a day. That's the best. If that's the best you can do, that's great. And then their basic wellness needs. So keeping up with their vaccines and their heartworm, flea, and tick product. Because in South Carolina, you mentioned you're not sure if we have fleas and ticks. We here in South Carolina, we are like the heartworm. It is hot and humid all year long. And what do insects love? They love heat and humidity, right? So we have I call them Jurassic fleas here. Like I grew up in Arizona. We saw fleas, but not like crazy. And then I worked in South Texas, Austin, Texas. And we had a lot of fleas, and I was like, okay. And then we came here, and I'm like, these fleas will not die. Like, we have like nuke your pet to get rid of them. Like, not really, but you know what I mean? Like you cannot try the over-the-counter stuff. The fleas are gonna be like, it's I feel a little sick in here, but I'm trucking along. Like people will say, oh, I tried Frontline, and like the fleas are just like they're like a cesspool. They don't care. They're like, we don't feel very good, but this is better than nothing. So, we get a lot of fleas. We have a lot of heartworm here. If you go to the American Heartworm Society organization and you pull up the little map of where heartworm is the most prevalent in America, South Carolina is like dark red. So those are things that, like, just basic wellness needs, that if you're doing all of those things for your dog, feeding them that complete and balanced pet food, keeping them exercise, keeping them lean, keeping them up to date on preventative care, even if it's the basics, the vaccines, heartworm, flea, and tick, your dog's probably going to do great, or cat, right? They're going to do really, really well. And then, of course, none of us can live forever. So you can be the best pet parent in the world. You can be doing you can be feeding them the best food, the greatest supplements. They could be nice and lean. You can be giving them bottled water, but they're not going to live forever. And that sucks. It really does. It's heartbreaking. So then when they get older, you may need to start considering doing that senior blood work and stuff, with the idea that, okay, hopefully whatever whatever develops, because something will develop, hopefully we can catch it early to manage it as long as possible, so that we can get as much time and maximize our time with our pets as possible. And if you're not able to do that, that is okay. There's no judgment. You just need to understand the trade-off, right? You don't catch it early, you might not be able to fix it or manage it as long.
I agree. And what are some of the red flags? You spoke about our pets getting older. What are some of the red flags that should never be ignored? Even if a pet seems like mostly fine, but they're displaying this one thing, there's no delay. They need to get to it. What's on your list?
I would say, unexplained weight loss. You had mentioned that earlier. There's so many different various diseases in the body, even just cancer, where your weight will kind of slowly drop. So I always tell people unintentional weight loss should always be investigated.
Okay, but if I'm referring to clinical signs, just for my listeners.
So I always tell people like extreme like restlessness, because sometimes that's all like some pets will do is like that you just all of a sudden they're panting a lot and they're just like circling. They lay down for a second, they get back up. They lay down for a second, they get back up. They can't rest, right? Sometimes that's all we see with like splenic tumors. That's what I noticed. I had a German Shepherd, and I walked downstairs one morning, I looked at him and I was like, get in the car. Because he was just like circling and panting, and his mucous membranes were nice and pink. His heart rate felt normal, but I was like, it's happening. So that's a big one. Or extreme lethargy, right? Your pet really can't walk from like the living room to the kitchen without taking a break, which is normally for them would be fine. Or you go to take them on a walk and they just can't, like, they just like laying down. And so extreme lethargy, extreme restlessness, and then obviously like retching. So like trying to vomit, but it's not productive. So that just like over and over and over again should always be seen right away. Then I want to be like seizures, pale mucous membranes. Like I could just go on. I can go on, but we know what to recognize. So I don't know that I could say that there's one thing that's like a big red flag, but those would be red flags for me. Like if a pet parent called me and they're like, my dog looks okay, but they're circling, they're restless, they're panting, I'd be like, I would just go get them checked out, because I can think of so many problems with just those words. But again, I'm paranoid.
I think it's better to be cautious. I'd
Yes.
rather receive a patient and go, no, they're fine. Just monitor this than
100%.
to not have the opportunity. So I think
100%.
pet owners often feel that they're wasting our time. That's, one comment that I often hear. I feel like I'm wasting your time. I'm like, this is what we're here for. We would rather, even the blood work thing where they're disappointed if you make a recommendation to run blood work and it comes back normal. I'm like, normal is good. Normal is really good. I'm pleased that this is not a waste of money.
Yeah, right. It's brought you so many answers of what is not the problem. So I always frame it to that. People like this was valuable because it's shown us all the things we don't have to worry about and all of the next steps we don't need to take. So this is great. This has saved us from so many worst case scenarios.
So before we lose the opportunity, what is the one sort of take home message and sort of misconception that you would like to clear up about vets and about their role as advisors on pet health and pet care?
Yeah, the most common misconception by far and away is that veterinarians are in it for the money. I'm sure you've heard that, right? We can't be trusted because we're trying to sell unnecessary treatment or push unnecessary tests. And I just can't imagine for the life of me anybody signing up for this job for the money, right? So, firstly, when you look at what you have to go through to be a veterinarian, it's basically what you have to go through to be a human physician. Maybe a little bit less, the residencies and all that stuff on the back end, but the beginning part and financially, the investment is very similar. So we're putting in the same amount of years, the same amount of effort. Actually, even in some places, you have to have better grades and stuff to get into veterinary school than medical school. Here in the States, it's hard to get into veterinary school than medical school. I know Ireland because my husband is from Ireland. So he said that in order to go to veterinary school, you have to have the highest score on the leaving certificate than for any other profession because it's considered one of the hardest. So it's really hard to get into veterinary school. You have to pay about the same amount of money. But then the return investment, we make 1/5 of what human physicians might make, especially depending on their specialty, right? A fourth, a fifth, maybe a third, depending on if you specialize as a veterinarian as well, or whether you're a business owner or what you're doing. It's not it's very rewarding, our career. I get so much joy and personal satisfaction from doing what I do, but financially the reward isn't there. So when I hear people say vets are in it for the money, I just can't imagine how they come to that conclusion. I'm like, well, you've obviously never actually worked in veterinary medicine. You've never been behind the scenes. You don't see we have the cat that we're like, please, we love you. We want to help you. And the cat's like, I will kill you. I'd rather die. And you're like, no, please. We got the cat gloves on. And of course, we're also trying to, make it as least stressful for that cat as possible. But sometimes we don't have the luxury of prescribing fear-free medications because they're super sick and they need it now. Right. So, and that cat's trying to eat us. And at the same time, you've got a dog over there that's having the most horrific diarrhea that you've ever smelled in your entire life. And then, you're covered in bunny hair or something, and it's in your eyeballs. And then there's an anal gland. It's not glamorous. It's definitely not something that I think anyone would sign up for just financial incentive. And I'm not saying we're destitute, right? But I'm saying when you look at our student loans often to the amount of money we make, it's very modest. It's good, it's decent. We make a livable wage. I'm very lucky to have a job that does pay decently, but it's not. I'm not driving a fancy car. I live in a small house. I don't go on lavish vacations. I definitely don't own a yacht. I will not ever be owning a yacht. So I just don't understand where that comes from, except for just, again, rumors or people who've never been in veterinary medicine. And every single vet that I have ever worked with truly went into this job because we love animals and we want to see them healthy and happy, and we want to help the sick ones feel better. And that is how we get paid, right? That's what fills our cup, at least for me. And I just wish like I could, every person who ever said like vets are in it for the money, I'm like, just come hang out with me for a week. Come just sit in the background for a week and then tell me what you think about it.
And despite all the challenges and misinformation and online backlash, what keeps you passionate about educating pet owners online?
Yeah, again, it's
because it's brutal.
Definitely, it's therapeutic. It's therapeutic for me, honestly. I don't like feeling like there's nothing that I can do, right? And that's how I was feeling when I was this first few years seeing outcomes of misinformation play out before my eyes in my patients and having to be on the defensive end of that. I was like, God, there's got to be like something that I can do, or I'm so frustrated by this and I just want to scream. So it became an outlet for me, and I enjoy it. And I've always enjoyed education, and I've always enjoyed client communication. I'm blessed to be a good communicator. I know that it's a strength that not everyone has. And I always tell everybody our greatest strengths can also be our greatest weaknesses. You know, maybe I'm not the best listener. I get excited and I just want to talk and talk. So, but you know, I want to use that to help as many pets as possible, because in my clinic and in my practice, I'm seeing on average like 20 plus or minus pets a day. And so I can only help those 20 pets a day. But if I'm also on social media, you know, it's amplified and it can reach hundreds of thousands of people and hopefully help hundreds of thousands of pets. And it doesn't take, you know, it does take work, but I mean, I think it's a very worthy investment of my time, because again, it keeps me sane. It makes me feel like there's something that I can do as opposed to being on the back foot all the time. And I hope it's helping, you know, provide or at least mitigate that myth a little bit about vets being in it for the money, or what our incentives really are. And I get messages from followers sometimes who are like, hey, you showed this thing about teeth the other day. So when I took my dog to the vet and I asked about teeth, and it turned out he had this rotten tooth, and I just thank you so much. Or somebody, you know, is like, hey, I saw that you said that we should be trying this instead of this thing. And I tried that and I've seen huge improvements. And those messages just like really make my day, right? Like I always tell the people who sent them, just like, thank you so much for taking the time to say that to me, because it really, really fills my cup.
I think you're doing a great job. And if my listeners want to find you online, tell them how to follow you.
Yeah, so you'll find me on Instagram mainly as The Honest Vet. I'm also on TikTok with that username and on YouTube, but Instagram is my bread and butter. It's my permanent home. So follow me there. If you ever have questions, or if you ever come across any pet information that looks questionable, please send it to me. I would love to bust it if it's a myth, or tell you that it's great.
I love that. Thank you so much for your time, especially so early in the day. I've really enjoyed this conversation. I know my listeners are going to love it too.
Good,
so thank you so much.
Thank you for having me. Enjoyable. I really appreciate being here.
It's been my pleasure. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Carra.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.